What is a dobutamine stress nuclear study? A dobutamine stress nuclear study is a test that uses a small dose of radioactive solution to track blood flow to the heart muscle and to evaluate heart function while the drug dobutamine is injected. Dobutamine mimics the effects of exercise on your heart by increasing the rate and strength of its pumping action. A dobutamine stress nuclear study is usually performed in patients who need a stress test but can't walk quickly on a treadmill and also have significant lung disease, especially severe asthma. The test can provide your doctor with information regarding whether or not you have significant blockages in your heart arteries. The test also includes an assessment of the pumping function of your heart. Common reasons to have this test: to determine if coronary artery disease is present and if further studies and/or treatment are required. To evaluate progress following a major cardiac event, such as a heart attack or heart surgery. To evaluate whether a blockage found during an angiogram requires angioplasty. To follow the progress of documented coronary artery disease. Preparing for the test. Different laboratories will have different specific instructions about how to prepare for this test. In general, you will be asked not to eat, drink, or smoke 3 hours before the test. Do take your usual medications with a sip of water, unless instructed otherwise by your doctor or nurse. Diabetics who use insulin or glucose-lowering agents may need to adjust their dosage. Always check with your healthcare provider if you are not sure. The test. The following is an explanation of a typical study. The way your study is performed may vary slightly from this explanation. Usually, you will need to allow approximately 3 hours for this study because it has several steps. You will be receiving the dobutamine infusion for approximately 15 minutes of that time. An IV will be started in your arm and a small dose of radioactive solution will be injected. This material is taken up by your heart cells and you will be asked to wait approximately 45 minutes after this injection. After that, you will be asked to disrobe from the waist up and will be provided with a gown to wear. Next, you will lie on a scanning table and a special camera called a gamma camera will be positioned close to your chest while you lie still. The camera takes pictures of your heart. This part of the test evaluates blood flow to your heart muscle at rest and takes approximately 20 minutes. Next, a specially trained nurse will place electrodes on your chest so that the electrocardiogram, or ECG, can be monitored continuously during the test. For men, limited shaving of the chest may be required to assure good contact between the skin and the electrodes. A blood pressure cuff will be placed on your arm so that your blood pressure can be measured before, during, and after stress. You will then receive the dobutamine infusion while you rest in a chair or lie down for approximately 15 minutes. The dose of the drug will be increased gradually over time, and the test will be continued until a specified target heart rate is obtained. If you notice any chest pain, dizziness, lightheadedness, or shortness of breath, inform the nurse. Near the end of the infusion, you will receive another injection of the radioactive solution so that blood flow to your heart during stress can be assessed. After completion of the dobutamine infusion, you will be monitored until your heart rate and blood pressure return to pre-stress levels. After this, you will have another break. This break is required to allow time for some of the radioactive substance to wash out of your gallbladder and bowel. Finally, you will lie back down on the scanning table to be imaged by the gamma camera for another 20 minutes. This part of the test evaluates blood flow to your heart muscle at stress. Is it safe? Stress testing is very safe. The likelihood of a serious complication such as a heart attack or death is less than 1 in 10,000. Keep in mind that you will be continuously monitored throughout the test by experienced personnel, and that the test will be stopped if there is any indication that continuing the dobutamine infusion would be unsafe in any way. A dobutamine infusion can cause transient side effects. Most people notice their heart pounding during the test. Occasionally, patients may notice that they shake or shiver a little. Neither of these effects causes any harm, and both effects go away shortly after the discontinuation of the drug infusion. The radiation exposure from the test is relatively small and not associated with any significant health risk.